which have at their core an integration of action on mental health and better integration into the overall health system. Making sure that that folks get the help and support that they need. And so that means making sure that it's culturally appropriate, that we're attacking systemic racism, that people are entering environments that are sensitive to who they are and have them be comfortable and safe in navigating the incredible challenges that are faced with mental health issues. Many of these are very intransigent, and of course they have at their core trauma. There's a direct proportionality towards people who've experienced trauma and incredible pain and the outcome to poor mental health. So it is not surprising then that our most vulnerable and marginalized people who've been subject to racism and the effects of colonialism are the ones who disproportionately suffer. And so we have to take a whole of government approach, and it's not just inside of our health system, as I know you advocate for. It's about making sure that we have housing. It's about making sure that we have food security for folks and that people have access to the full range of 360 supports that you need when you're in that kind of state. And the thing I would say about why it's so important to do that is that when you don't appropriately deal with somebody who's in a state of mental health crisis, that situation will deteriorate and manifest itself in all kinds of other terrible health outcomes. And of course, a person can't be productive if they don't have strong mental health.
Thank you so much. I will switch in French. One
of the factors affecting mental health is environment. This week, we saw a report come out to the effect that the air in Canada has been affected by last summer's forest fires. So what are we doing at that level when it comes to health and the environment? There is no more important an issue than this. Our environment. It's our environment, and that's our future. It's essential to our future. It's also essential that we come up and respect an action plan to fight climate change. Taking action in the current context as well is important. When there's an environmental crisis, we must be there to work on the situation, to improve situation, to ensure that people receive the services they need in such situations. And that's why our agencies are there when there are environmental disasters such as the forest fires, and this will remain the case in the future. This is also why it's of the highest importance to continue our action for clean air by respecting the pricing for pollution precepts and many other actions for the environment. It's linked to our health. Our health is linked to our environment. It's so important to attend to this. And the cost of forgetting this, of not dealing with this, would be extraordinary and totally unacceptable to Canadians.
Thank you, Madame Briere. And thank you very much, Minister. Dr. Lucas, all kinds of tributes to you today. Let me simply wish you a long, happy, and healthy retirement. Thank you again for your service to the country, but also for the numerous times that you've come before this committee and been extremely patient and professional with mental health and addictions. And welcome to the officials joining us for the second hour of this meeting. From the Canadian Institutes of Health Research, Samuel Weiss, Scientific Director, Institute of Neurosciences, Mental Health and Addiction. From the Department of Health, Jennifer Sachs, Associate Assistant Deputy Minister, Controlled Substances and Cannabis Branch. And from the Public Health Agency of Canada, Nancy Hamzawi, Executive Vice President, and Michael Collins, Vice President, Health Promotion and Chronic Disease Prevention Branch. Welcome back to the committee, Minister. You have 5 minutes for your opening statement. Please go ahead.
Thank you, Mr. Chair, and to honorable members. It's a pleasure to be joining you here today, and thank you for the invitation. I'm looking forward to having meaningful and important conversations that I know matter to Canadians. I'm pleased to provide you with updates on some of the work we are doing to address the issues of mental health and substance use. But before I begin, to add to the many tributes to Dr. Stephen Lucas that are well-deserved, since coming into this position, Dr. Lucas and his team have really guided myself and Minister Holland with such a steady hand and a calm vision of what is important in the health of Canadians. Dr. Lucas, you leave a legacy that is impressive by all standards and accounts, and you have served Canadians so well, and for that we are truly grateful. Colleagues, this past fall, our team and myself launched the 988 Suicide Crisis Helpline, providing access to bilingual, trauma-informed, and culturally appropriate suicide support to all Canadians. It is available 24 hours a day, 7 days a week, and I know we've worked across party lines on this initiative because helping Canadians should never be a partisan issue. In its first 2 months of service, 988 responded to over 72,000 calls and texts from across Canada. This helpline represents an important step forward in providing timely and accessible access to crisis mental health supports. We continue to work to build the overall capacity of the healthcare system through our historic investments of $200 billion over 10 years. This includes $25 billion in bilateral agreements that outline specific actions, including those to improve access to mental health and substance use services. Through these agreements, some of the actions supported by federal funding include supporting more integrated youth service hubs, reducing wait times for community mental health and substance use services, expanding access to provincial programs that provide counseling and support, and prioritizing culturally appropriate services where needed. On top of these specific actions, mental health and substance use care is being integrated throughout the whole healthcare system, from family health services to the health workforce to data and digital tools. This will improve the system's capacity to respond to patients' needs for mental health and substance use support, because as we know and we say often in this place, mental health is health. Tragically, the toxic drug supply and overdose crisis continues to cause immeasurable pain, suffering, and heartbreak across our country. I want to acknowledge the important work this committee has been doing to study this critical issue. I know that we all share the same determination to end the overdose crisis and to save lives. This echoes what I'm hearing from my counterparts across the country, that we have the same objective, helping Canadians. To do that, we need to learn from experts, in particular those working on the front lines of this crisis. They are truly the heroes of the healthcare system. We need to listen to those with lived and living experience, including family members. And as leaders, we need to work cooperatively to ensure a comprehensive and compassionate approach that is patient-centered. Our government's actions are guided by Canada's model, our goal to ensure that all Canadians have access to services and supports across the spectrum of prevention, harm reduction, treatment, and recovery, while also leveraging enforcement tools to keep our communities safe. As part of our approach, we are investing in programs like the Substance Use and Addictions Program, which allows us to support community organizations who are working directly to reduce harms and support people in need. As you've heard or may know, the illegal drug supply is deadlier than ever before, with potent substances like xylazine and nitazines entering the already lethal illegal drug supply. This reality puts all those who consume substances at high risk. It also compels us to act to ensure that life-saving interventions are widely as available as possible, including in rural and remote areas of the country. Colleagues, we have much more work to do in this space. However, I look forward to having meaningful discussions today on the work that is already in play and how we can better serve Canadians. I look forward to your questions.
Thank you, Minister. We will begin with rounds of questions, starting with Mr. Doherty, please, for 6 minutes.
Minister, thanks for being here today. I have a lot of questions, but first, I know you probably saw Minister Duclos and Minister Anand's press conference on fraud yesterday. Has Mark talked to you about fraud at Health Canada?
I am aware that they are looking into those allegations.
So you're aware of some investigations mentioned yesterday pertain to Health Canada?
I know that there are investigations that are ongoing.
Okay. So are any of the new 5 to 10 cases being examined from your department?
At this point in time, I am not aware that they are.
Okay. So, okay. Thank you. There are investigations underway that involve PHAC.
PHAC also crosses not just my department, but Minister
Okay.
Holland's.
Okay. Thank you.
You're welcome.
Okay. Thank you. Minister, is diversion illegal?
Yes, it is.
Okay, thank you. Minister, is London Intercommunity Health Centre receiving funding through SUAP this fiscal year?
Yes, it is.
Okay, thank you. Minister, have you read the new letter from 72 BC-based addictions doctors blasting so-called safe supply?
I have read the letter, and I've met with many of the experts
Okay.
and physicians with regards to safe supply.
Thank you. Mr., when Dr. Sarita was here the last time, she mentioned that she admitted knowing that some of her prescriptions get diverted. Question, why is her clinic still receiving funds, taxpayer funds?
Thank you for the question, and as I've said in this committee before, I take diversion very seriously, as do all of our department, and at that time, we asked officials to thoroughly review the protocols of all of our 21
Okay,
safer
so has
supply
the funding been
projects.
cut off? Your testimony just prior to that was that she is still receiving funds. Her clinic is still receiving funds. Taxpayer funds that are going to, what you said, to a clinic that is prescribing safe supply, that they know, the prescribers know, some of it is being diverted.
So overall, across Canada, diversion is not something new. We know that there are low
Okay.
levels of diversion.
Do you
that
have the
happen.
evidence?
The
you have evidence
RCMP has
regarding-
provided thorough information on their position on diversion. Are you referring specifically to a nationwide lens or specifically to
Is
that
there a
one project?
nationwide lens? Like, is there evidence nationwide with respect to safe supply
The
and diversion?
RCMP has said that there is no evidence of widespread diversion of drugs from prescribed
Oh,
alternatives.
that's interesting. That's interesting because just last week, you're probably aware of it as well, too. There was a large bust in my home community of Prince George where the local officers and local leaders, RCMP leaders on the ground there that said there is widespread evidence and that it is taking place in our small rural communities. Are you aware of that?
I'm aware of that, and I'm also aware that Assistant Commissioner John Brewer at the Top Mountie in BC said that notable quantities of prescription drugs were seized, but there's currently no evidence to support widespread diversion of safe supply drugs in the
So-
illicit market in BC or in Canada.
So are the frontline officers that are actually on the ground making these arrests, are you saying that they're lying?
I'm saying that the data is showing us from drug analysis seizures over the past 10 years, including when the Conservative government was in power, that there's been no increase in diversion of hydromorphone over the last 10 years based on the samples.
So there was no...
So from your
how-
previous government's
So how long has
administration
the
until
SUAP
now,
program
there's been
been in
no
place?
change.
How long has the SUAP program been in place?
Pardon me?
How long
The
is
SUAP
this?
program is ongoing, and the next round of funding will be for the next 2 years.
Okay. Minister, how much, so prescribed safe supply has been, your government launched a program, spent about $700 million on that, almost $1 billion. What work did PHAC do prior to, or your department do prior to launching that to study the evidence that safe supply was indeed safe?
So I've just returned from Vienna, where I was at the UN Drug Commission meeting with counterparts such as Switzerland, Portugal, and many other countries who have long-standing evidence of the importance and value of
But I didn't ask
prescribed
that. I
alternatives.
asked what work
So
was
there's
done
ample
prior to.
I'm answering your question. You've
But you,
asked
no,
what
you're saying that
evidence-
you attended. What work was done prior to, by your department, prior to launching that? That was my question.
We are relying on evidence of other jurisdictions to begin our evaluation
Is it-
of what would work
Is
here
it scientific evidence or is it
Absolutely.
anecdotal evidence?
No, it is not anecdotal evidence. Switzerland has a long-standing prescriber.
Because it's
prescriber
interesting. So
model.
are the 72 doctors and indeed the other 42 leading addictions specialists, are they lying when they say there's no scientific data beyond 7 weeks at the 1 week mortality rate? with Safe Supply?
I reject the premise that anyone is lying. As I said in my opening remarks, we value the opinions of experts, those with lived and living experience, and clinicians, and we include all of them in our contemplation